Welcome back to What the Study Says. If you've ever felt like the advice on cholesterol changes more often than your phone's operating system, you are definitely not alone. I mean, one minute eggs are the enemy, the next they're totally fine. It can be really confusing. So get ready because the official rulebook on cholesterol just got a massive, massive update for 2026. So let's cut right to it. Did the rules for managing your cholesterol just change? The short answer is a big, resounding yes. The American Heart Association and the American College of Cardiology have just released their 2026 guideline on the management of dyslipidemia, which is just the fancy medical term for unhealthy levels of fats in your blood. This new guideline pretty much retires the old version from 2018. You should really think of it like a major software update for your heart health. And today, we're going to break down exactly what that means for you. Okay, let's dive right in. We're going to use what journalists call the inverted pyramid approach. What's that? Well, it just means we're giving you the most important, need-to-know news first, right up front. So if you only remember two things from this entire explainer, please make it these next 2 points. Here they are. Number one, start earlier. The whole philosophy has shifted. It's now all about reducing your lifelong exposure to those artery-clogging particles. And that means we need to identify and treat risk much sooner in life. And number two, calculate smarter. The tool doctors have been using to estimate your risk of a heart attack or stroke, it's been completely overhauled to be way more accurate. So start early and calculate smarter. That is the new mantra. All right, so let's get into the why behind all of this. What's actually new here? What are the biggest shifts in thinking that are driving these changes? Well, the single most significant change, the one that really underpins almost everything else, is the brand new risk calculator. So what even is a cardiovascular risk calculator? You've probably heard of it. It's basically a tool that takes your personal health info, things like your age, your blood pressure, your cholesterol levels, and it crunches the numbers to estimate your probability of having a heart attack or stroke over the next 10 and now even 30 years. This risk score is absolutely critical because it helps you and your doctor decide if and when to start medications, like statins. And this slide right here shows the upgrade perfectly. The old calculator, which was called the Pooled Cohort Equations, or PCE, is officially out. It's being replaced by the brand new Prevent-TEM equations. So why the change? Well, this new tool is based on much more diverse and modern health data, which makes it a way better predictor of risk for today's population, covering adults from age 30 all the way to 79. The guidelines even give us this really memorable way to think about the new approach, CPR. First, you calculate your 10-year risk using the new Prevent tool. Then, you personalize it by talking through all the factors that are unique to you with your doctor. And finally, you can reclassify that risk if you need to, using other tests like a coronary artery calcium score to get an even sharper picture. See, it's a much more nuanced, individualized process now. This whole shift is actually so significant that even the name of the guideline has changed. It used to be called the Guideline on Blood Cholesterol. Now it's the Guideline on Dyslipidemia. And that one-word change, it signals a huge philosophical shift. The focus is broadening way beyond just LDL, the so-called bad cholesterol, to the entire ecosystem of particles that contribute to plaque buildup in our arteries. So, what else are we looking at now? Well, the 2026 guidelines put a much bigger spotlight on other troublemakers, things like elevated triglycerides, which is another type of fat in your blood, also a really sticky genetic particle called lipoprotein A, we just call it LPA for short, and finally, using a test called a CAC score to look directly for existing plaque buildup in your arteries. And speaking of that CAC score, this is one of the boldest, most aggressive new recommendations in the entire guideline. A CAC score measures the amount of hardened, calcified plaque in your heart's arteries. And the new guideline now says that for any adult with a score of 300 or higher, and trust me, that's a lot of plaque, it's time for aggressive treatment to slash LDL cholesterol by at least 50%. The message is crystal clear. Finding significant plaque changes the game completely. Now, with all this talk of new calculators, new targets, and new medications, it's really easy to think we can just medicate our way to perfect heart health. But the guidelines could not be clearer on this point. While the technology and the science have evolved, the absolute non-negotiable foundation of preventing heart disease hasn't changed one bit. Lifestyle is still king. I actually want to read this quote directly from the guideline itself because it's just so important. It says, lifestyle management is foundational for ASCVD risk reduction and should accompany medical therapy to obtain the best outcomes. See, it's not an either-or situation. Lifestyle isn't what you try before you consider medicine. It's what you do every single day, whether you're on medication or not, to get the absolute best results possible. And what does that lifestyle look like? Well, the guidelines point right to the American Heart Association's Life's Essential 8. It's a simple but really powerful checklist for optimal heart health. It covers all the big ones. Eat better, be more active, quit tobacco, get healthy sleep, manage your weight, and of course, control your cholesterol, blood sugar, and blood pressure. Okay, we have covered a lot of new ground. So the most important question is, what do you do with all this new information? The whole goal here is to empower you for your very next conversation with your doctor. The guideline uses this one phrase over and over again, the clinician-patient risk discussion. And what that really means is this isn't about your doctor just telling you what to do anymore. It's a partnership. It's a real conversation where your doctor explains your risk and your options, and you share what's important to you, your values, your goals, so you can make a shared decision on the best plan for you. And to help you start that conversation, here are some really direct questions you can bring to your next appointment. You can ask, should we be using the new Prevent calculator for my risk assessment? Or, based on these new 2026 guidelines, do my treatment goals need to change? And depending on your situation, you can even ask, should I be tested for LPA or maybe have a CAC score? Asking these shows you're an engaged partner in your own health. So we'll end with this thought. The science of preventing heart disease has just received a major upgrade. And the question for all of us is this: is your heart health plan running on the latest software? If you found this breakdown of the new cholesterol guidelines helpful, please do us a favor and subscribe to What the Study Says and share this explainer with your friends and family, anyone you think might benefit. Thanks so much for watching.